Hello everyone, welcome back to Medical Knowledge. This video is the continuation of my very first video, which was on the anatomy of the upper lip. In that video I told you mainly about the joints. In this video I will tell you about the muscles, talking specifically about the scapular muscles. I will tell you about their origin, their insertion, their innervation and action. I will also show you the images of the diagrams of the scapula and humerus or the vertebra, wherever the muscles originate and where they exist. So let's start. Everyone, the first muscle I will be talking about is the infraspinatus. The infraspinatus originates from the infraspinous fossa of the scapula and inserts on the greater tubercle of the humerus. It is supplied by the suprascapular nerve. You can see here, this is the infraspinous fossa of the scapula. The infraspinatus originates from this portion of the scapula and gets inserted on the greater tubercle of humerus right here. This is the greater tubercle and this is the infraspinous fossa. It is supplied by the suprascapular nerve. Talking about the action of the infraspinatus causes the lateral rotation of the shoulder. So I will write it action as the lateral rotation. And you can see here it originates from here and inserts on the greater tubercle of humerus. Okay everyone, the next muscle I will be talking about is the supraspinatus. The supraspinatus originates from the supraspinous fossa of the scapula and gets inserted on the greater tubercle of the humerus. It is supplied by the suprascapular nerve. You can see here, this portion of the scapula is known as the supraspinous fossa. The supraspinatus originates from this portion and gets inserted right here on the greater tubercle of the humerus. Talking about the action of supraspinatus, the supraspinatus causes the abduction of the arm during the first 15 to 20 degrees. The main action of supraspinatus is the initiation of abduction during the first 15 to 20 degrees, then the deltoid takes over. Okay, now the next muscle I will be talking about is the rhomboid minor. The rhomboid minor originates from the C7 and the T1 vertebra and gets inserted on the medial border of the scapula. It is supplied by the dorsal scapular nerve. You can see here it originates from the C7 and the T1 vertebrae and gets inserted at the medial border at the base of spine of scapula right here. Talking about the action of the rhomboid minor, the rhomboid minor causes the retraction or the pulling back of scapula. I will write here. It causes the retraction or the pulling back of the scapula. The next muscle I will be talking about is the rhomboid major. The rhomboid major originates from the T2 to T5 vertebra and gets inserted on the medial border of the scapula. It is supplied by the dorsal scapular nerve. You can see here it originates from these vertebrae and gets inserted on the medial border of the scapula, which lies right here. Talking about the action of the rhomboid major, the rhomboid major also causes the retraction or the pulling back of scapula. I will write here. It causes the retraction or the pulling back of the scapula. Okay, the next muscle I will be talking about is the teres minor. The teres minor originates from the lateral border of the scapula and gets inserted on the inferior aspect of the greater tubercle of the humerus. It is supplied by the axillary nerve. You can see here it originates from the upper 1/3 of the lateral border of the scapula right here, the rhomboid minor, and gets inserted on the inferior aspect of the greater tubercle right here. Talking about the action of the teres minor take place in the lateral rotation of the arm. Okay, now the next muscle I will be talking about is the teres major. The teres major originates from the lateral border of the scapula and gets inserted on the intertubercular groove of the humerus. It is supplied by the lower subscapular nerve. You can see here it originates from the lower 2/3 of the lateral border of the scapula and gets inserted on the intertubercular groove of the humerus, which lies right here but is on the anterior aspect of the humerus. It is supplied by the lower subscapular nerve. Talking about the action of the teres major take part in the medial rotation of the arm. I will write here. Okay, now the next muscle I will be talking about is the subscapularis. The subscapularis originate from the subscapular fossa of the scapula and gets inserted on the lesser tubercle on the humerus. It is supplied by the subscapular nerve. This hole right here is the subscapular fossa. The subscapularis originates from here and gets inserted right here at the lesser tubercle of the humerus. Talking about the action of the subscapularis, it causes the medial rotation of the arm. Okay everyone, all these were the scapular muscles. If you liked my video, give it a thumbs up. If you have any query, you can ask me in the comment section, and kindly subscribe to Medical Knowledge. Thank you for watching.